This is NDTV, and you're watching NDTV 24/7.
Good evening, you're watching NDTV with me, Rishika Barua. This is the show where we take your questions on the coronavirus. As usual, we'll be joined by a panel of expert doctors. If you have any questions on your mind regarding the coronavirus, do call us on the number flashing there on your screens. Dr. Sharad Kumar, consultant endocrinologist, joining us from Lucknow. He's also a professor at a medical college in Lucknow, so senior doctor and medical teacher with us. Dr. Puneet Verma, the director, chief interventional cardiologist of the ACE Heart and Vascular Institute, Mohali, is also joining us on the broadcast. Appreciate you, doctors, for being with us. I want to begin by asking you, a lot of global research is out there. Every other day, there's a new study on the coronavirus. Everyone is looking for a cure. Dr. Kumar, if we could begin by asking you, how does an ordinary person, decipher what is to be believed, what is to be trusted, and what is not?
Yeah, that's a very important question. Actually, what we are stuck with that this is a new disease, new virus that we have encountered. So even the medical fraternity is just in the phase of learning as the situation is unfolding day by day, we are trying to decipher the intricacies of this prevention and cure. So every day, many companies are venturing into developing vaccines. And as on date, as I have read in the paper, I think around 80 odd companies are struggling to find out a vaccine. Now, the problem is that development of vaccine is fraught with danger also. So we just cannot fast track it to a larger extent.
Right.
So I think we'll have to wait and watch and hope for the best that sooner the vaccines should come.
Dr. Verma, is there anything that you'd like to add, anything that you'd like to tell our viewers? We all have a tendency to, open the internet and read, multiple research material, multiple articles on the COVID-19. What shouldn't you believe?
Yeah, see, it is replete. There is an abundant data now, but unfortunately the period of the disease and the pandemic is so short. And whatever publications we have had in the international index journals, they are narrowed down to a few drugs which nevertheless have still shown variable efficacy. And one really is not sure as to which one would be really the frontline drugs as of now. But yes, there are a few in the pipeline, a few which have undergone human trials, and few which you would certainly like to prescribe to your patients if you find them in a sick state.
Right.
Otherwise, coronavirus, by and large, this disease should be just treated symptomatically.
All right. Our first caller, Noel, is on the phone line from Mumbai. Go ahead.
Hello.
Yes, go ahead. Ask your question.
My question is, I have two questions. Basically, I'm 78 years old. Me and my wife live alone. But if one is asymptomatic, will the air conditioning in the bedroom affect the other person? Because now we are staying in separate bedrooms. And the second question is, my wife has COPD, and we are doing steam inhalation. Some say it is good, some say it is bad. Whether steam inhalation is good for the virus or it clears your nose. These are my two questions. Thank you.
All right. Let me then divide this up. Dr. Kumar, would you like to take on the first question? Asymptomatic carriers, what if you're in the same air-conditioned room with an asymptomatic carrier?
So the problem is that asymptomatic means that there are no symptoms. But exactly the situation is that viral infections may definitely be there.
Right.
So if infection is there, one is likely to spread. So if the two persons are sharing the same room, whether it is air conditioned or not, the chances become more.
All right. And what about steam inhalation, doctor? Does steam inhalation aid? Does it help?
Yeah, first I wanted to complete the first question.
Yes,
if the air conditioner is on, that means the ventilation is limited. So the chances of cross-infection becomes even more.
Okay.
So this is point number one. And second is steam inhalation. Yes, the steam inhalation is good. As the gentleman said that his wife is suffering from COPD. So for COPD patients, steam inhalation is definitely good. Having said that, steam inhalation is said to be good as far as preventing a further infection is concerned. So it is good and it is better if one can continue with doing steam inhalation.
All right. So those are
Yes.
some of the good practices. Neeraj, our next caller is on the phone line from New Delhi. Go ahead.
हाँ मैम, मेरा क्वेश्चन था कि मैं लैब टेक्नीशियन हूँ, मुझे क्या क्या सावधानी बरतनी चाहिए, क्योंकि मैं घर घर जाके सैंपल लेता हूँ, हेल्दियंस एक कंपनी है उसका.
All right, Dr. Verma, would you like to take that on? Neeraj is a lab technician who goes to different people's houses to collect samples. What are the kind of precautions he should take?
Well, the precautions would still remain very, very specific as for any healthcare worker. That means he should actually be exercising good hand hygiene, and he should be always having his mask up whenever he handles these patients. And preferably when he is sampling these patients, it would be advisable if he has a face on an eye shield as well. So this would really protect him from any immediate exposure, howsoever short he may be staying with those patients of his.
All right. Neeraj, those are some of the answers. Eye shield is very important, and any PPE kit that any health worker is using should be used by you. And once again, thank you for continuing to do what is a very difficult job in these times. Our next caller, Pankaj, is on the phone line from Mumbai. Go ahead.
Good evening, Pankaj from Mumbai. Will you prefer 2 elevators instead of one in a 9-story building with a population over 100? In a hotspot like Mumbai, will one elevator operating during these COVID times in the same building be sufficient to achieve the objective of safe physical distancing? Or will you prefer 2 elevators, as it will do a better job to help maintain physical distance? It gets crowded when 4 people get into that one small elevator. What's your advice?
Right. Let me ask. Yeah. Do you have another question?
No, that's all.
Okay, let me take that to Dr. Kumar then. Dr. Kumar, what about using elevators in the time of coronavirus? One elevator used by multiple people, especially in residential complexes. What would you like to advise them?
See, the point is that if in normal circumstances, the chances of getting cross-infected if only 2 persons are moving into the same elevator are not really very significant. But if one of the person is infected, and the lift is being shared by other guys, then chances of cross-infection do definitely become increased as if comparing to the situation when a person is moving alone. Having said that, we have to be really practical that how far it is possible to, where I understand people line up in a queue to get into the elevators. So how much it is possible to sort of separate one person taking a person going alone in the lift. So is it possible or not? So I think personal protection equipment to the extent possible should be stressed more rather than taking the person alone in the lift.
All right. Our next caller, Shamim, is on the phone line from New Delhi. Go ahead.
Hello. You see, remdesivir, which is an antiviral drug, has been approved by USA's Food and Drug Administration based on more than 1,000 patients of plasma-controlled tests. So there were placebo-controlled tests on more than 1,000 patients, and based on that, FDA has approved it on an experimental basis. My question is, should we not begin trial of remdesivir in India?
All right. So very specific question there about remdesivir. Dr. Verma, would you like to take that on?
I think remdesivir as an antiviral would soon be out in the Indian market. I think the manufacturing processes have already started. Having said that, you must remember that all these antiviral therapies, whether it started with a double dose of oseltamivir and now remdesivir and maybe some other antivirals as well, they are actually their use is best reserved for the very sick patients. It is not going to be used as a norm, as a routine in any COVID positive patient. But certainly its use and its efficacy has been proven. But however, you still need better and larger trials. But since the time and the pandemic state, we are in such a state that really there won't be too much of time to really experiment with drugs and all. So whatever data, as long as it's a well conducted study and the results are pretty much objectively documented. I think yes, remdesivir as an antiviral agent holds promise, but it's certainly not the end of the research as far as COVID treatments is concerned.
All right, Dr. Kumar, is there anything you'd like to add?
Yeah, I would just like to add. First, I would agree with Dr. Verma has said. I would just add that see, in a medical science, we depend on a large sample size
Right.
for a disease. For a drug to be effective in a disease, I think 1,000 patient is not a very large sample size. So I would just agree what he has said, that it holds a good promise, but the results have to be gotten. We have to sort of time test them, and larger trials and over a period of longer time would be more effective, and then we'll be more confident in using it. And again, I would like to add that this is not a panacea. This is not something that you give the drug and you will be okay and you will be cured. Only thing is that the recovery time is shortened, and there is, yes, there is some benefit in the quality of life of that patient. Yes.
All right, our next caller, Gaurav Sharma, is on the phone line from New Delhi. Go ahead.
Hi, how are you, Dr. Verma and Dr. Kumar? I would like to ask from both of you. See, I have been visiting all private hospitals for a variety of reasons in April. And to my surprise is that every second hospital is announcing that their even staff and the doctors and even nurses are getting coronavirus. So how do you see the future of Indian healthcare? What will happen to all hospitals if they are contaminated? Mainly, there is a huge burden of non-COVID patients in the hospital.
All right, Dr. Verma, a lot of concern about, patients who regularly visit hospitals for treatments for other diseases, who are now concerned about the rising cases of COVID among the medical fraternity. Dr. Verma, would you like to take that on?
Yes, so I think the directions from the government are emerging that we must have two kind of hospital setups, even if it's in the private sector. The COVID and the non-COVID hospitals, but there is a good chance that even the non-COVID hospitals of today may become the COVID hospitals of tomorrow. Having said that, we should adopt and adhere to strict screening protocols at the entry point especially in the non-COVID hospitals, and screen out patients who appear to be potentially the COVID or the COVID-like, having COVID or COVID-like symptoms. So if you are able to do that and then direct these patients appropriately to the right place, I think by and large you will be able to segregate hospitals and manage to treat your non-COVID patients well.
All right, our next caller, Pillai, is dialing in from Mumbai. Go ahead.
Good evening, doctors. My question is this, corona, especially in crowded places like in India, is now spread more or at least equally by asymptomatic carriers than by symptomatic carriers. Now, in this event, does this contact tracing mobile app, which is now made compulsory, help at all? I mean, even by a stretch, it can only warn you of contact with persons who have self-declared symptoms. There is complete blindness with respect to the asymptomatic population. So is this app useful at all, or is it just a distraction that may make us complacent? And a related question, by the same mistaken notion, does it make sense to isolate everybody in an entire building in a place like Mumbai just because one person in some corner of one flat has got infected? Okay. And so, hospitals too, for that matter. Okay. Thank you.
So two questions. I think one, Dr. Kumar, if you'd like to take that on, very interesting question. The efficacy of the Arogya Setu app and contact tracing when the number of asymptomatic patients is as high as 80%. That's a very interesting question.
Yeah, the point is once the infection starts appearing in the community, and that is by and large through the asymptomatic carriers and asymptomatic patients or carriers of the infection which do not have symptoms. Now, really, it is very difficult situation, and it will be practically it will not be possible to depend upon Arogya Setu to sort of get cautious while if any asymptomatic person is approaching you or not, because those patients, those persons who are asymptomatic are not fed into it, so it will not be useful for preventing yourself from coming into contact with asymptomatic persons. But definitely, so far what we understand is that the situation is not become that grim. that more infections are getting spread through these asymptomatic carriers. It is what we are doing, what we are afraid of right now is that the symptomatic patients, where we can trace the contacts, trace the source of infection, are generally spreading the infection.
Okay.
So yes, your point is very well taken. This may not prevent cross infection while coming into contact with asymptomatic persons.
And very briefly, doctor, would you also like to answer the question on one person testing positive in a residential complex of thousands of people and everybody is quarantined? Is that advisable? That's something that the government has followed very strictly.
That's a very difficult question. That what is the sort of building size and the residents and the facilities of quarantining everybody. And as I said at the outset, you see, we are in the learning phase.
Right.
But as we have understood that the spread of infection can be in the air to up to the 2 meters.
Yes.
So if the person is in the same building,
right,
the chances are definitely, if one can isolate the entire, at least quarantine
so
or educate the residents of all
it's perhaps a cautious measure, to isolate and quarantine as many people as possible, even if you have one positive case in a large residential complex. We're going to slip into a very short break at this juncture, but both Dr. Verma and Dr. Kumar will continue to be live with us on the other side. Keep your questions coming. Welcome back. Dr. Puneet Verma and Dr. Sharad Kumar continue to be live with us. Our next caller, Ajay Gupta, is dialing in from Faridabad. Go ahead.
Hi. First of all, I would like to congratulate all the Corona warriors, media, and the doctor fraternity pan-India. My question to Dr. Verma is that, nowadays there is something which is happening is, people go out, and when they go out and when they come back again to their room, to their home, they need to wash their hands, right? Now what will happen is, yesterday I went to one of the shopkeeper. He said the number of people who are coming across, we have a lot of exchanges happening. So my question is, how much time does the virus still remain there on any of the surface, like the notes or the exchange, what we are doing it? So what is your suggestion and your opinion, how the people should go with it?
I think your question is about surface transmission. Doctor, would you like to take that on?
Yes, certainly. See, fomites is a very important medium of the contagion being transferred from one to the other. Broadly speaking, if you just have surfaces of various kinds, say a stainless steel or a plastic surface or a melamine surface, you have a virus thriving for as high as 72 hours. You have a thing like a cardboard, it can reside for maybe 24 hours. But remember that all these surface fomite transmissions and all are also now we believe that as the temperatures in the subcontinent rise, this duration of the infectivity of this could decrease. Certainly that's one possibility. Having said that, I also must allay your anxiety that please, this is an important, it's a contagious disease, but at the same time, please don't panic and create a panic anywhere, wherever. If you think you have had a contact at a shop,
right,
just come, exercise your hand hygiene, wash your hands well with soap and water.
Yes.
If you have brought any such material from the shop which you can clean equally well with water or anything, say it's an eatable item, it's a vegetable, it's fruits, you can handle that very well. So my aim is just to tell you that please don't panic about these things.
Right.
See, after all, the aim in this pandemic is also to create a herd immunity. Unless you do that and you are not really going to progress well in the pandemic.
All right. I think very, very useful information there, Doctor. Last caller on the phone line, Nair from New Delhi. Go ahead.
Hello. Good evening, sir.
Good evening.
Hello.
Good evening. Please ask your question.
Okay. Let me first of all give my heartfelt congratulations to all the warriors. Okay. I am a banker I am calling from Delhi. I am 57 years of age. So in 2014, I had a pulmonary embolism was there, and now I am continuing with warfarin tablet. So is there any, and as banker, as you know, I am daily going to office also. So is there any particular caution that I have to take for this?
All right. Would any of the doctors, Dr. Kumar, would you like to take that on?
Yeah, definitely. If you had a problem and you have been prescribed warfarin, under no circumstances you should try to stop it. You must continue your medication, and it needs constant monitoring, and that's very important. That monitoring should not get delayed by any reason. You must continue the medication and all the precautions that have been given to you.
All right. So if you're suffering from any kind of a precondition, do continue, with. Okay, do continue with your medication, and of course, don't feel afraid to get in touch with the doctor. Let me also take this to Dr. Verma, because I'm sure, Dr. Verma, a lot of heart patients also have these questions because they do take medication for a prolonged period of time. How does does that change in any way? Should any medication be altered? What would you advise? What advice do you give to your patients?
Not unless the medical specialist or as a cardiologist we advise our patients. See, we are telling all our patients to please continue with their medication. Number one.
Right.
Number two, in case there are any symptoms or any side effects, so-called side effects or adverse effects we are noticing in our patients, then we are certainly asking them to come to us in the clinic, or if not possible, whatever is possible through teleconsultations, we are advising them to continue with their prescribed medicines unless and until there are strong reasons to modify those drugs.
All right. So any modification, however, should be done under medical supervision. So, you should contact your doctor for that. But Dr. Verma and Dr. Kumar, thank you very much for sparing the time and being with us on the broadcast this evening and so patiently taking on all those questions. That's all we have time for on the show this evening. But up next is the 8 p.m. news. Do stay tuned. Sonia, what's coming up?
Well, all the latest numbers, because this really is a story of data, and the number of cases have gone up, Rishika, but the good news is that the ratio, that's the number of cases testing positive to the ratio of that to test, has actually dropped. Lots more after the break.